Hi, and welcome back. A Spin studio in Ontario recently reported 61 cases of COVID-19, one of the biggest outbreaks at a fitness center in Canada.
Now, this all started with one gym goer or super spreader who managed to get several others sick while putting dozens of others at risk. And here to help us understand how super spreaders work is infection control epidemiologist Dr. Colin Furness. Dr. Furness, nice to see you. Good morning.
Good morning.
All right, first let's talk Halloween, if we could. As we were telling folks at the top of the show, Dr. Teresa Tam says that trick-or-treating can go ahead with caution, but some people fear that this Halloween could be a super spreader event. Where do you stand?
I have been saying that Halloween is something that should go ahead unless we end up having to do some kind of large lockdown between now and then, and I don't think that's likely. Halloween is outdoors. It's supervised by parents. I think we need to throw down some ground rules about things that we should avoid. I think we can be resilient. I think for children's mental health and everyone's mental health, we need these sorts of things to look forward to. This is not a dangerous activity if we're smart.
All right, so let's talk about what is a dangerous activity. Tell us what makes a super spreader.
So what we find with COVID is most people who get it don't give it to anybody else. And some people who get it give it to lots of other people. That tends to be the pattern. It's not linear. It's not like everyone who gets sick gives it to two people. The reproductive numbers suggest that it's linear like that. It's not. So a super spreader event will tend to happen when people are sharing airspace indoors for a prolonged period of time with poor ventilation. So you add that together, and that describes restaurants and bars and gyms to a large degree. You put people in that situation, and you will find that one person can make a lot of people sick.
Yeah, does there have to be a certain amount of people? Is there a threshold of people that have to be infected for it to be a super spreader?
There's no actual objective definition for that. In my own mind, I guess there's two things. One is that it's sort of more than three, more than, four or more, because that means that you're above the average, the reproduction number. But even more important is that those are then people who go to different households. So if you have spread to 5 people all in the same family, in the same household, that's infection within the family. It's when you're in the community and you give it to several people and they then go into their own households and represent a gigantic amount of risk. That's a hallmark there.
Now, in this particular case at the fitness center, patient 0 didn't have any symptoms. What does it say about the likelihood of catching the virus in places like that, or, as you mentioned, restaurants?
What makes COVID so dangerous, what makes COVID so effective, is the fact that it spreads very well asymptomatically. That is, before people end up feeling sick, or maybe they never go on to feel sick at all. We think more than half of all COVID spread is fully asymptomatic, which means the people who are doing the spreading don't know. They don't know to stay home, and we can do all the screening we want. It's not going to catch them if they're feeling absolutely fine. That's what's really dangerous, and that means that just relying on people's good judgment and honor system, it's not enough. We can't say, oh, well, stay home if you're feeling unwell, don't go to the gym. They're not feeling unwell. They go to the gym. This happens.
Which I guess underlines the importance of contact tracing if you've come in contact with somebody who's possibly infected. But is contact tracing reliable, and is it always possible in a super spreader event where so many people could be infected?
So contact tracing is one of the most important public health tools we have to make epidemics stop, or to at least bring them under control. But you need to have capacity. You need to have rapid testing. I mean, you need to know within a day if someone is sick, and then you need to get on the contact tracing right away. Hours matter, days matter. In Toronto right now, we're no longer able to do contact tracing because every new case brings dozens and dozens of contacts. So that's obviously a very dangerous situation. For super spreader events, they're actually easier to identify with contact tracing because it doesn't take long to find that kind of convergence, as long as all the people live in the same public health unit, right? So if you have a gym or a restaurant that's right on the boundary of a public health unit, and people are coming from 2 different places, it can be harder to spot. So that can be an issue. But mostly when you have lots of people with something in common, it's a lot easier to spot than small contacts here and there.
Now, in some parts of the country, people can still go to gyms. What advice do you have for people who are still going to work out?
I would say that in order to stay healthy and in order to keep your loved ones and friends and community members healthy, you should never be in a room with other people without masks on unless you live with them. So if you are in a gym or you're in a yoga class or whatever it is, and there's ventilation and everyone's wearing masks and you don't have a lot of community spread, then that would seem to be okay. But any time that you're exercising or anyone around you is exercising without a mask, you've got risk, and this is avoidable risk.
Yeah, and at that cycling studio, they had masks on before and after the session, but not during that cycling session. Dr. Furness, thank you so much for your time. Really appreciate it.
My pleasure. Thank you.